Well, hi. It's been 3 weeks and a few days since my prostatectomy surgery. Today is a Thursday, and it was 3 weeks ago, Monday, to be exact. So, last time I checked in, I said we were getting ready to go have our pathology report. We did. Surgeon gave us a lot of interesting information. One of the pieces he had said was that what they called nodules or tumors inside my prostate were so significant on the right side that they were starting to protrude through the outer layers of the prostate. So essentially, he had said that if we had waited another 1 or 2 months, then we could have been having possibly a completely different discussion about treatments and so forth. Some of the other things he had said was that there is a fatty tissue, if you will, that got removed with my prostate. And just inside the fatty tissue, they found one cancer cell. It was 1 millimeter in size. He said it was very tiny. It was the only one they found. They were kind of fortunate that they did spot that one. Out of the 16 lymph nodes that they removed, they didn't find any cancer cells there. And out of the nerve packages that were removed, there was nothing significant reported on those either. So, all in all, it was a good report. He said that, well, I need to go into kind of a monitoring phase now. So, in 3 months, January, I'll be getting my PSA check. And then in another 3 months, which will make 6 months out, I'll have my next PSA check. And he said the number they're looking for is zero point 0.0. He said anything zero point 0.1 or higher is something to potentially be concerned with. Incontinence. Yeah, still dealing with some incontinence. It's gotten a little bit better in the third week. And I don't know if it's just that the leakage is better or I've just gotten more adapted to dealing with it, or maybe a little bit of both. So there's two different pad sizes I'm using. The larger one that I showed last time, I use that one more in the evenings when I'm going to sleep. And then in the daytime, I'm transitioning to one that's just a little bit more narrow. I do that because it's a little bit more comfortable. When I first put that larger pad in, walking around it isn't as comfortable. It kind of rubs up on both sides of my legs. Where when I use the skinnier one, it's more comfortable to walk around in. What I did notice though is one time when I was wearing one of the skinnier ones, I had a bad episode of leakage, if you will, and I got the actual panty layer a little bit damp from that. But that was the only real episode I've had so far. All in all, it hasn't been too bad. We did go out and do some more shopping for Black Friday. Today is Thanksgiving, and I did fairly well. I kind of got more tired and sore than I did in dealing with continence. I did mention last time that we were going to go maybe try a concert, so we did that. It was interesting. So the concert was at the latter part of my 2 weeks post surgery, and I did use the thinner pad when we went there. I will say that the first time I attempted to go to the restroom, and it was in between sets, and I know there's a long line there. And it was a little bit challenging to try to understand if the stalls were empty because everybody's in line for the regular urinals. I don't know, felt a little uncomfortable, I guess. So what I did for the next two bands is I just got up during a song that I wasn't as interested in. No lines in the restroom. Went and picked my stall and took care of business that way. So all in all, it was good. Definitely enjoyed getting out with my bride and seeing the bands. And all in all, yeah, it was good. The driving wasn't an issue at all. I think by the end of the evening, I was probably just a little bit tired and a little bit sore down in my abdomen area from walking around. I do want to touch on bowel movements a little bit, the BMs. So, as I mentioned previously, they had me on a stool softener while I had my catheter in. And I've noticed that I've had to stay on the stool softener, and I've had to add a laxative about every other day in order to have a proper bowel movement. I'm not really taking a lot of pain medication anymore. I do take some extra strength Tylenol every now and then, especially if I know that I'm going to be out or if I'm going to be sitting for a while, because it just gets really sore down below. It gets a little bit more uncomfortable. So, I'll take some extra strength Tylenol. So I don't know if that's kind of aiding to the constipation or if it's something else. It's kind of difficult to say. Outside of that, I feel like I'm doing pretty good. The stomach, all the air seems to be gone now. I did move a bit, something that was rather heavy the other day, and I kind of pulled in my stomach area, so now I'm paying for that. I got a little soreness back in there again. I am using my treadmill. The surgeon has suggested I don't use incline, so I'm keeping it flat for now until I can build that back up and kind of get into a rhythm. But it's been really nice getting back on the treadmill and exercising again. Outside of that, I guess I'll check back in a couple of weeks, let everyone know how it's going. Outside of that, have a great day.